Speaking a second language is really involved, but what happens when you also stutter? My name is Dr. Sarah Lobegeiger de Rodriguez. I'm a certified practicing speech pathologist, and today we'll be talking about what to do if you stutter and you're also bilingual. There is a lot to think about when it comes to bilingualism and stuttering, and we also have research on this too. So if you're learning or speaking a second language and you also stutter, it's normal to feel like your fluency is really affected. When you speak a new language, you will find yourself word searching, concept searching, fighting for correct grammar, as well as facing increased performance stress, especially if the language is new or you're taking it to work as a professional. Plus, there are delicate social expectations and differences across our diverse cultures which need your attention. Add stuttering to the equation, and suddenly processing, regulating, and feeling at ease in conversations becomes more of a challenge. Today, I want to dive into the correct strategy for you to take. See, for over a decade, I've been delivering stuttering therapy in a multicultural space for my adult clients globally through our online clinic, SPEECHAUS. My team and I assist at that interface between you, English as your second language, and your stuttering and fluency goals. First, I think it's a good chance to share and investigate the key definition of stuttering. It provides us with a lot of information about what to focus on. So if you've ever wondered, stuttering is a motor speech disorder that impacts speech fluency and may involve behaviours such as sound or word repetitions, blocks where the sound is stuck, or even secondary behaviours such as facial grimaces and increased speech anxiety. Although the research evidence is limited around how to fix stuttering in adults, we have yet found no effective approach to cure stuttering in adults despite lots of research. We do have insights into the most appropriate treatment approach that will support you if you stutter as an adult and also if you're bilingual. These days, the best method points to smooth speech. This is an evidence-based behavioral modification approach which uses techniques such as starting gently, stretching, and linking. It essentially involves speech framing that is rhythm and sound focused. Smooth speech can be applied to all languages successfully, so you can use it in your English, your Arabic, French, Mandarin. It goes across all languages. And when practiced and utilized daily, you will find that smooth speech techniques give you some degree of control over stuttering, reducing the likelihood and incidence of stutters on syllables. It won't cure you, but it will provide you with resources and agile methods to correct your speech in the heat of the moment to gain increased fluency and naturalness. If you're watching this episode and you speak more than one language, today I want to emphasize the importance of never leaving one language at the door when you start stuttering therapy. So let's stop for a minute. Consider your language skills for a moment. Which language is your dominant language? The language you feel at ease in, the one you use the most? If you have difficulty working this out, no problem. You may just happen to be a balanced bilingual. When you know your language dominance, we can then target your treatment adequately. So balanced bilinguals are those who move between languages with predominantly consistent comfort. If you have a preference for one language over the other, it doesn't suggest the other language is inferior. It just means that you're more likely to be dominant in that language. At SPEECHAUS Clinic, we've uncovered some pretty solid evidence that language dominance affects the severity of your stutter. That being said, you'll see the same types of stuttering behaviours across all your languages. And in the language that is not your dominant, you will notice probably a higher rate and frequency of stutters. If there is a large discrepancy with stuttering primarily occurring in only one language, this can indicate an imbalance in language dominance. And what if you're a balanced bilingual? Well, as I mentioned, a balanced bilingual is a person who is equally proficient across their languages. Usually, balanced bilinguals will have similar severity ratings and percentages of syllables stuttered across both languages. Now, you may be a polyglot and speak 5 languages. If they're all balanced, you'll also see the same trend. In speech therapy, we know that good treatment follows detailed assessment. So if you're about to commence a stuttering therapy program, be sure in your assessment session to discuss language dominance. At SPEECHAUS, our team will ask you questions around your languages and stuttering. We will also take a speech sample in your core languages. Multilingualism is the best thing for your communication, and so we don't want you to leave one language at the door before your stuttering therapy starts, because we're waiting to work with you in both languages. Our team will custom design your treatment session so that you're practicing your speaking strategies in both languages. This will give you the best outcomes. Let's consider a case study to bring it to life for how it might work for you. So a short time ago, we were working with a client who spoke Arabic and English. They saw Arabic as their dominant language. From discussions and speech samples, we noted that the stutter was more pronounced in English when compared to Arabic. Since our client stuttered in both languages, we allocated speech tasks and home practice in both Arabic and English. Our client was trained to use the same effective stuttering techniques for both their languages. Early in the program, our client was worried that the smooth speech technique of linking did not fit with what Arabic needed. See, they wanted to make sure they were true to the rhythm and flow of Arabic, even when using their stuttering therapy techniques. Naturalness is an essential part of fluency. So we discussed the top priorities to control the stutter. A great solution was achieved. The client decided that when speaking English, their main goal to prevent their stutter was linking, and when speaking Arabic, their main goal changed to soft starts. This was a happy medium for the client, who reported feeling as if they were in control of their stutter while also maintaining naturalness across both languages. Now, as I've promised, we're about to get into 4 clever tips for bilingualism and stuttering. These are adult-focused strategies well suited to you if you're an adult who speaks more than one language and stutters. Tip number 1 is to poise. We know that pauses can be a risk factor for stuttering, but at times you may need additional time to code switch. So selecting a word in your target language from your dominant language and transferring it across. Our recommendation to you here is to take your time, have a breath, take a moment of poise to gather your thoughts and then speak. This will allow you more time to focus on your fluency techniques from the beginning of your phrase. If you're always stopping and starting due to code switching from your first language or formulating ideas, brainstorm some measures to increase your vocabulary or use techniques to structure your thoughts more effectively. When English is your second language, you will notice there are so many words that are tip of the tongue. So I've left a resource to a vocabulary workshop that you can take. Check the comments description below. Now let's get into our second strategy. Tip number 2 comes with no surprise: practice. We talk about this topic a lot. Some clients report that their stuttering increases in certain environments or when feeling a certain emotion. This is why transfer practice is essential. I want you to role-play situations where you know your language skills and fluency skills will be challenged. Maybe it's the job interview you're preparing for, or the newest proposal you'll be making at next month's meeting. No matter the situation, there's always an opportunity to practice your skills in the plausible setting where you want to gain increased fluency. Strategy number 3 is Preparation. Think of your contingencies. While you can never be prepared for every situation or worst case scenario, you can prepare. Control what you can control, and in this case, it is your fluency and your vocabulary. Continue to update your vocabulary with specific terms needed for upcoming meetings, networking events, and practice this vocabulary daily while using your smooth speech techniques. If you know that your boss likes to throw challenging questions, make sure you have a strong, expressive language structure to reduce the chance of being caught off guard, which you might find increases your risk of stuttering. Remember, stuttering is personal. The ways in which people who stutter experience life and navigate their stutter will always be different, so knowing what you need is truly important. Changing goals is also a really great way to get to know yourself and your stutter and find out what it is that you really want for your communication. This is something that my team and I will assist you with. We help you identify the communication settings and create a hierarchy of where your practice focus should be so that you integrate the communication skills you need with your fluency techniques together. My last strategy number 4, relates to proficiency. Just like any task that you're learning, the less proficient, the more you need to practice. Stuttering severity can increase in your less dominant language. Therefore, why not focus on practicing and perfecting your fluency techniques in your less dominant language? It may be harder, it may be more frustrating, but we promise the more you commit to daily practice, the easier it will become for you to master. Consider this. Just like in archery, our arrow has to be aimed and pointing in the right direction to hit the bullseye on the target. The more you practice it, the greater the likelihood you hit bullseye. Stuttering techniques are exactly the same. They benefit from practice, which cinches and solidifies your muscle memory and awareness, so that in the moments you matter, you're more likely to integrate and get your techniques doing the work to reduce risk of stuttering. Now, at this point, I'm sure you have many questions, so now is a great chance to drop any questions you have in the comments, but I want to address a question that's probably come to mind to you already, and that is, can stuttering therapy be effective if my speech pathologist doesn't speak all the languages that I speak? Yes, it absolutely can. Lee, Rob, Ormond and Blomgren found in 2014 that monolingual English-speaking speech pathologists were accurate judges in assessing stuttering severity across their clients' first and second languages. Language familiarity was not necessarily a prerequisite for accurately identifying stuttering behaviours in unfamiliar languages. We as speech pathologists don't need to be familiar with your first language to hear stutters. We will hear them. Van Borsel and Brito Pariah also found that speech pathology students, those who are not yet qualified, were also able to identify individuals who stuttered from those who experienced everyday disfluencies, things like pauses and ums, even if they weren't familiar with their client's language. The next question that often comes up in assessment sessions is about bilingualism and stuttering. A lot of clients ask me, both languages guilty of making me stutter? So they want to know, Sarah, when I speak English, I stutter. Is it causing the stutter? Or I noticed that my Italian, like I've stuttered in Italian since I was a kid. Was it because of the Italian and also trying to get English happening at the same time that I stutter? So let's address this important question. Before you start thinking you need to avoid one of the languages you speak, we want to assure you that stuttering is not associated with language development. However, stuttering can really mess with the fluency rules of your second language and may further contribute to anxiety, frustration, and communication confidence levels. Some data speculates that bilingual kids are at a higher risk of stuttering. However, the research is still not solid enough to prove it. Other people believe that learning a second language increases the severity of the stutter, but to this day there is no proof of that either. As it stands, learning a second language will not increase the severity of your stutter. Stuttering doesn't discriminate between languages, countries, or cultures. If you're a person who stutters, you're likely to face similar difficulties across all the languages that you speak, and they occur in any country in the world. Sometimes there can be some common misconceptions among the public about what a stutter is. It is therefore essential that you advocate for yourself and for other people who stutter. Stuttering can affect your participation and comfort at work, school, or even in the home, but fortunately, it will never interfere with your IQ. Don't forget that. Juggling all the skills you need to move across both of your languages, managing a stutter, feeling less comfortable speaking at work or in class, oof, we know how tough that can be. It's these feelings we encounter among the clients we love serving in our clinic at SPEECHAUS. I mean, this is why I'm filming this piece for you. So if you're feeling worn out from your communication concerns, there are strategies to help with the heavy lifting, and we can't wait to show you how. It is a skill and honor to be able to speak multiple languages, and at SPEECHAUS we strongly advocate for this. Even though there is a range of conflicting research around stuttering in bilingual children, we will focus in on you as an adult, and your stuttering in situations. After all, you're multilingual, you're no longer a child, we have best practice and good research to support you. So now you've come so far and maybe you're thinking, where should I go from here? Well, if you're itching for more tips, you're looking for extra support, wanting feedback, or would like to get some new ideas for your fluency and need a bit of advocacy, we've got you covered. You can book an assessment today if you're new to SPEECHAUS. We'll provide you with the best evidence-based pathway for your stuttering concerns. The first step would be to book a diagnostic stuttering assessment if you're new to SPEECHAUS. In this assessment appointment, we'll provide you with the best evidence-based recommendations for your stuttering concerns, ready for a treatment program. Alternatively, if you're already one of our clients, I invite you to book a refresher session if you're seeking some new advocacy and supports for your fluency. You can find all the details in the description box below. We work with clients worldwide, providing an advocacy-first approach to stuttering therapy. Thanks so much for watching this video. I hope you found the suggestions and strategies useful. Don't forget to give it a thumbs up. Ask me any questions in the comments below. I'll definitely reply. And if you enjoy this type of content to empower your speech fluency and even English pronunciation, be sure to subscribe to our channel. Thanks so much for watching, and ciao for now.